Morning everyone, and thank you for joining us in today's webinar. I'm Anne Livingston and I will be the moderator of today's webinar, along with our guest speaker, James O'Reilly. Today's webinar will focus on the Redlands Coast Social Data Project, a new system to share knowledge and monitor community needs. Our webinar today is being hosted by Global Community Resourcing for our online platform, the Community Care Smart Assistive Technology Collaborative, and we acknowledge the Queensland Government's seed funding for that project. At Global Community Resourcing, we've been fortunate to work on a large variety of both local, national and international projects with community care professionals as well as researchers from across the globe to share and create innovative ideas in community care settings. And I note today that we've got many of our international collaborators on board, and I just put a call out to those who've joined us today from Canada and from the UK. Many of you who have joined us before will know that our webinars are created based on feedback and requests that we've received through the collaborative. And we aim to connect the diverse perspectives in research, as well as development and creation and deployment of assistive technology and a broader range of smart technologies in the community care sector. Just a reminder, if you haven't already formally registered at the collaborative site, it's accessible to all and free to register. A range of resources, news articles and collaboration opportunities are regularly uploaded to the platform, and you can visit satcommunity.com.au to become a member. Many of our research projects have emerged from collaborations within that site, so I encourage you to express your interest in it. In terms of just declaring our independence, please note that we are not promoting or endorsing any product, research entity or organisation. Rather, the direct purpose of our webinars is to inform viewers of various smart technologies currently in deployment or in development that can advance the delivery of community care across all elements of the primary health care sector. We welcome questions during the presentation, but I will let you know that all microphones have been muted. This is in the interest of recording. If you have any questions or comments, please add them to the question pane on the dashboard to the right of your screen. At the end of our webinar, we will be selecting various questions to ask our presenter for further discussion. So please add your questions early during the presentation, and Georgie behind the scenes will be moderating those questions. In today's webinar, our guest speaker is James O'Reilly. We're really pleased to welcome James to our webinar today. James is a consummate professional, and he's going to talk about the work that he's been leading around the Redland Coast Social Data Project, a very unique initiative and leading the way for local governments. This initiative was developed by Redland City Council and Griffith University Regional Innovation Data Lab. The project involves the creation of an online information sharing dashboard that can improve service planning and delivery of services by community care providers. It's a great honour, James, to have you on board today, and over to you.
Excellent. Thanks so much for the introduction, and good morning, everyone. My name is James O'Reilly, and I'm Redland City Council's Strategic Advisor of Social Planning. And in today's project update, I'll be providing you with an overview of Redlands Coast Social Data Project. This has been heralded as a new system to share knowledge and monitor community needs, and it revolves around collaborative data. So just the content that we'll run through today, a little bit about me, a snapshot of Redland City, Council's approach to social infrastructure planning, current state planning limitations, the social data project itself, the various phases of that. I will talk a little bit about how the COVID-19 impacted that project in particular, next steps and questions. But before I continue, I'd like to acknowledge the Quandamooka people who are the traditional owners of the lands, waters and seas where we meet today. And I acknowledge the elders past, present and emerging. And I extend that respect to any Aboriginal or Torres Strait Islander people in attendance. And in my own way, I'd also like to add what a privilege it is to live amongst the oldest living culture in the world. So a little bit about me. I studied town planning at university, or urban regional planning. I had a meeting with my careers advisor in year 12 and he said, James, what do you like to do? And I said, I like SimCity and I like Lego. And then he's got the easiest job in the world and he said town planner. So I went ahead and studied that. I'll be honest and say it's not like Lego and it's not like SimCity, but I enjoy it thoroughly anyway. So I did urban regional planning, architecture at QUT Gardens Point, Brisbane City. I worked for, or have worked for, state government, local government and private sector. I wanted to get a really roundabout knowledge of the whole system and work my way forward from there. I got a little bit tired of working with legislation and focusing on the bricks and mortar, and I had an interest in how communities operate, because at the end of the day, social planning is a greater focus on communities or the people themselves. And so in a nutshell, that's working to improve the quality of life in communities, and different governments and different organisations will have different approaches to social planning. And I'll talk about Redland City Council's approach today. A little bit about me personally. I do remote area scuba diving, mountain climbing, and my goal when we're finally allowed to travel again will be to climb Mount Kilimanjaro. So I need to get my aerobic fitness up for that, because I've been sitting down on the couch for quite some time. So that's my goal. So hopefully travel opens up soon. I'd love to do it. And just some of the photos you see there. So I was lucky enough to go to Tufi, which is on the very southeastern corner of the peninsula of Papua New Guinea. And because it's so remote, you just see so much incredible wildlife, schools of manta ray, and even going nature hiking, seeing some of the endangered birds of paradise. So that's the red bird of paradise there that my brother took a photo of. I only had a GoPro, and as you know, they can't zoom in properly, but there you go. So I'm really passionate about nature, wildlife and traveling. So hopefully I can get back to doing that soon. A little bit about Redland City. I might just slip to a map of Redland City straight away for those of you overseas and in different areas of Australia that might not be familiar. So we've got Brisbane City Council, Logan City Council. We're talking about the very corner of Southeast Queensland, and Gold Coast City Council. And Redland City Council, obviously the entirety of this local government area here. It encompasses the southern Moreton Bay Islands, North Stradbroke Island, extends up to Thornside and goes as far down as Redland Bay and Mount Cotton. One of the things that I'll talk about in this project in terms of how we measure community needs is we're quite reliant on data from the census, or we were, that was our primary source. And what's quite difficult is we lump these areas here, like the islands, all in one category called a statistical area. This in particular would be a statistical area 2, and the entire local government area would be a statistical area 3. But it's quite difficult, for example, to get data just for these little areas on their own to see how they're performing. And we've enhanced that through this project, and I'll tell you how we've done it. So for those of you who aren't familiar with social infrastructure or social planning, different organisations will have different focuses. So for me, my role here at Redland City Council is focusing on community facilities, community networks and community services. You'd all be familiar with community facilities. They're the places we connect and access resources free of charge, libraries, galleries, community centres, etc. Council's role there is direct, but it's not exclusive in terms of the responsibility of planning and provision of community facilities. So that's my primary role. We involve ourselves in community networks, and that's a support and partnering role. We can play different roles in that, and they're important social structures that maintain and attract services to the city. Very important for supporting changing community needs. And probably the most critical at the end of the day, who I would call our frontline receivers of community needs, are community services. So they're the essential services to support the health and well-being of the community. We're talking about youth, mental health, general health, support aged care, Indigenous and community services. Council doesn't deliver those. Back in the day, they may have delivered a few in relation to childcare, etc. But in today, and for Redland City Council in particular, it's an advocacy role on behalf of the community to ensure that community needs are supported and resourced appropriately. So we've got a vested interest to make sure that those are robustly supported and that changing community needs are catered for. So Current state social planning limitations, community facilities and how we plan for those. It's quite easy. You can just use a benchmark for population growth. So for example, a multi-purpose community centre, you need one of those effectively for every 30,000 residents. Council would provide some, the public sector or private sector might provide some, other non-government organisations would provide some, and then that makes up the necessary amount to support your community. Community networks, our goal there or our benchmark is to have all services connected with a relevant network as needed. But when we get to community services, it's quite difficult to form a localized benchmark on need because they're always changing. So yeah, we can look at population size, but community needs are quite difficult to analyse. We can get a snapshot at a point in time, but it can not be quite accurate. We're quite reliant on anecdotal evidence through networks. We don't really know what locational access is like, network coverage. And by that, I mean, do we have the proper institutions in place that offer early access, case management, tertiary management, and have we got all those available within our local government area or at least our region? Are we being serviced correctly? So it's a bit of a limitation. We've got sort of one eye closed. We can't really see that visibly, and that's what we're aiming to improve. So these are the limitations summarised specifically for those community services. So what resources exist within a service network and what is the volume of service needs being raised by the community? We know that changed very, very rapidly during COVID-19, and that was, I hate to use the word, but that was our pivot point of adapting to that. Our referral networks, so what programs are on offer within a service network and where can a community member be referred to if they have more specific needs, and our level of coverage. Again, within a network, who is providing early level support to the community and who is funded to provide more intensive case management. And moreover, the big question would be, what are the gaps in service coverage based on that information above? So we understand our limitations and looking towards our future state planning goals. This would be the ideal situation, what we want to work towards. So for council in particular, it would be to have more accurate data and use data analysis to support good practice. And ideally, we want that to be collaborative. And for those providing services who we want to support and advocate for, it's visibility of services in a network, plan and advocate to meet emerging needs, and evaluating approaches and impact over time. So completely central to that is the availability of good and accurate data that we can support between each way to help us both achieve our goals. And that's collaborative data driving good practice. So we understand our limitations, we understand our goals, and now we want to reach out to our special partners who can help us achieve this. So in mid-2019, we engaged Griffith University's Regional Innovation Data Lab. They're a not-for-profit, publicly funded body, so very easy for governments to engage directly, not needing to go to tender or anything like that. They help speed up that process, and they're a very rich, a data-rich environment for us to tap into, which is fantastic. So we asked them three different phases effectively of the project was develop a social provisioning gaps analysis. That's a bit of a needs analysis for the city. We wanted to do a data collaboration with services and networks, and that's through direct engagement. And the big tangible component of the project that we want to see updated moving forward and continuing to be used was the development of a localized data sharing dashboard. Collaborative probably is a key word in that too. We want it to be free for users. We want it to have excellent information. We want it to be a co-designed solution for data sharing. And that's allowing council and partners to upload new local information so that we can all work together towards similar goals. So that was the project. This was the first phase of the project that was considered in December 2019. And that's a needs analysis for the entire local government area, but drawing back on those smaller areas in Redland City that we couldn't necessarily get good data for. And we focused on individual and community wellbeing domains, being not maternal, material living conditions, employment, health and wellbeing, learning, personal and community safety, community strength and connection, life satisfaction, and access and availability of services. And that would cover more or less the entire cohort of the full services and offer, as I spoke to before. You're speaking about your general health, your mental health, well-being, learning, early childhood, etc., and also your crisis-based services as well. So the goal of that needs analysis was then to provide recommendations for service collaboration, where to target. Obviously quite limited with budget, and given the monstrous size of the service cohort, it's quite difficult to just go the whole hog and engage with everyone. So we wanted to do that in a targeted way, but knowing where best to target. So we decided to look at services providing domestic and family violence support and early childhood support. The reason that we did that is we knew they had a good availability of current data, they had established networks, and after reaching out, there was a strong expression of interest in participating. So here we get to a big project curveball, being COVID-19. And this just summarise everything we've done to date. So in December 2019, we had a baseline indication of community needs that had been completed, fantastic. And then we were ready to do targeted engagement. And we had a strong expression of interest from multiple sectors of the community, and it's going excellent. And then of course, we get to the point where things are getting closed down. We're going into lockdown, and everything that we knew in that 2019 report saying these are the needs for the community, they're rapidly changing. Okay, that's off the charts. And for any project manager to say that their projects always run smoothly, they've never reached a hiccup, that's straight up a lie. So of course, this was my curveball, and we had to adapt to this to keep the project going. And a bit of a blessing and a curse, and I'll get into that. So the reason it was a blessing was because information and data sharing had become really, really critical. Our only gap was what we thought were the issues, and they had rapidly changed. But that still gave us a baseline indication, and now we could get a new indication of how that had changed. And we had there was a series of captive audiences and networks' willingness to share information. So that had just been enhanced tenfold. So we had to do scope change and broaden engagement. And anyone living in Queensland or Australia, or even thinking in America and other countries, obviously there was quite a crisis with accommodation, rising house prices, support for people in rentals, people just under a series of pressures, financial pressure. So we enhanced that to broaden engagement on housing, JobKeeper impacts, and different support services. So gathering as much information as possible is critical at that time to support community needs. And so what we had between points 1 and 6 here, we had a baseline indication of community needs in I guess, normal time. And then we had an extreme circumstance where we had a capacity threshold identification. That's a really positive impact on the project, because it's actually a testing environment to see we are here and this is the capacity of what we can deal with, or even this is starting to blow out our wait list. So we know what our resourcing is like in the community sector too. So it was quite interesting that that came along, fortuitous in a way, but also in a terrible way, if that makes sense. So I'll just get on to show you the actual dashboard itself now. And I'll just have to refresh that page. Excellent. So this is the tangible final result of the engagement that we've done today with the Regional Innovation Data Lab and all the data collected to date. I'll make a note that the information that you're seeing here is a light version. It doesn't cover any sensitive information that was provided through our networks. They're only available to council and services who contributed through a password login. What you're seeing here is purely open source information. So I'm happy to send this link out and you can have a look at the light version of the dashboard. And I'll just give you a general run through. So here, based on our earlier domains, you can see Australian Early Childhood Development Census, our schools and enrolments, our population projections, Department of Social Services payments, kindergarten enrolment. So there's a series of data there. And being able to localize that on our individual suburbs that wasn't really possible through normal census domains. And we can overlay our networks through that and see how those networks are responding and what their capacity is. This will give us some more localized information, and I'll show you some more examples soon. And then we go into our family and community wellbeing domains. That will go into things like your JobKeeper, some of your crime statistics, financial stress indicators, and some of the searches that are being undertaken by the community in terms of what service needs they have. And that changes over time. You're looking at 2020 data there, and we're about to get the 2021 data in a few weeks' time, and I'll update services when that occurs. So anytime there's an update to information, I'll be providing that back through our networks. But let's work through some examples here. So let's have a look at, for example, this is the Australian Early Childhood Development Census, and this will show you vulnerability of children in terms of their progress on different wellbeing domains. If I hover over the map here, you can see the population or projected population, or 2021 estimated resident population. That's got your job seeker or those who are accessing, so that's 3.3% of that particular suburb. And it's got your number of children vulnerable on 2 or more domains. And as I said, we were investigating a little bit closer early childhood and the provision of services. So that information is quite easily to access itself. But what's excellent is that I can then overlay which childcare services in the National Quality Framework are there to support that community. So I can have a look at those meeting the National Quality Framework, those are working towards, and those exceeding. So you can have a look at the local government array of services supporting early childhood. So this in particular, if I was analysing this, would tell me a few things. One, there's a good variety of services, but I'd start to have a look at the vulnerability of children in different domains where there might be a clustering of that particular issue and what services are available there on offer. So for these sort of areas here, I'd be saying these are where we're meeting or working towards but not exceeding. And so then I can see the number of approved places for those and where early childhood access is essentially available. And one of the other domains would be the actual accessibility of those services. So you remember that map before that I was showing you for the Southern Moreton Bay Islands and North Stradbroke Islands. You've really only got one that's available there, and it's got a working towards in the National Quality Framework. So just an example of how we can start to overlay the data to more accurately reflect areas that we want to work towards. What else can I show you here? So let's go job seeker data for the end of 2020. So this is December 2020, quite recent. And this will show you the percent of certain areas in relation to job seeker. And I just wanted to show you the disparity between certain areas. So for example, here's Victoria Point. I can see the percent receiving JobKeeper in December 2020 would have been 3.8. And then if I jump over to less accessible areas, you've got that jumping up to 12.2. Okay, so just some disparities between local areas there and where we might need to provide additional report or advocacy. We'll jump down. So a series of available resources there, and jumping down to map 2, where I can see some different things. Another aspect that came out of through engagement, the data availability. So estimated percentage of people affording a night out or with no access to emergency money. So again, you're looking at about 9% versus up to 23%. So some fairly critical information there. And if I was also to jump back and to have a look at the early childhood development census as well, and being able to have a look more specifically at the Redlands Islands and have them not grouped together. So here's an individual layout of specifically what's occurring in those areas. And I'll see if I can blow that up a little bit closer for you. Okay, so for Macleay Island, I can see where those vulnerabilities are for specific areas down to Russell Island, North Stradbroke and Carragara. So that's grouping areas specifically or individualised rather than a whole SA2 catchment. So that's really useful. Just jump back into the presentation. All right. So one of the other things that we're able to see through some of the searches being undertaken for the community by specific elements of support, this is how that information changed over time during COVID. So we've got 2020 in January, February, so on and so forth. And you can see the volume of some of those searches in relation to food, etc., etc. So as those changed over time for your smaller areas and being able to identify those more specifically, you're seeing the volume of needs, but then by highlighting a network and the capacity to respond, you're aware of the localized capacity. So you won't be able to see this here, but that's saying the organisation's name, which would be Redlands Love and Hope, which is a not-for-profit, providing emergency food relief through the food bank. They're servicing 40 to 60 clients monthly. This is in April 2021, so this is quite current data. And they've also got capacity to support food delivery to vulnerable persons where capacity allows. Now that's really important, because if you had people self-isolating and they were elderly, obviously with having an aging demographic in Redland City, that's really critical information to know. So we can start to adapt that as it changes over time. We're about to get new information on this and see that how that has transitioned in post-COVID. So one of the gaps before, obviously, with our community services was we could only really measure population size, what that meant for services, and some anecdotal evidence that was coming out of our networks. Now we are fully aware of community needs, how they're changing over time, and we can relay analysis and information back to our services. We know what our locational access is like. We've got identified services for the local community with capacity indicators, and we've got an idea of our network coverage too. That's identification of early support services and tertiary funded services. So as I said before, this is a lighter version of the dashboard. We've got some more critical information, but that's kept in a sensitive way in a secure environment for those services and council. But that's some of the information that allows. So the next step for this project, or evolving over time, would be for continuous improvement. We want to enrich the availability of data for other services. As I said, we did it in a focused approach, and we want to start expanding that out over time. We want to do our mental health networks. We'd like to have a look at community transport, and we'd like to do benchmarking and evidence-based advocacy, or regional service provision comparisons, i.e. services per person. We can't say, for example, what Logan government area and what the nature of their services would be and do a similar exercise for those. But what we could say is, well, we have one service available, or one funded service available with 2 equivalent resources, for example, for 15,000 people. What's that looking like in different local government areas, and how does that compare to our own community needs? I'd also like to see this information start to spread across council and other non-government organisations, or even the private sector, or anyone that's supporting community needs. Obviously, my lens is a social planner, so I'd like to see some of those social data outcomes enhancing planning outcomes, some for how are we using our community facilities to support those changing community needs. What's our open space and recreation planning for, looking like parks? If you can identify the areas of disability or needs for core assistance in a certain area, then what sort of equipment are you putting in your parks? Where do you want to really enhance access to support people? If people are living in an isolated area, how can you help them be more mobile and have connection to those services as well? So that really sums up what I wanted to talk about today. There's a whole other host of information in the dashboard which I didn't get to, and I'm happy to show more of that and share that link out too for people to have access and see what capabilities or potential that might mean for them in their planning activities. But before I finish, I just wanted to say thanks again to Anne and Georgie, and a special note of appreciation to the Regional Data Lab, who are really fantastic providers, and all the services who supported the development of this project. I just realised that I omitted one slide from the presentation, which is quite important. Whilst I jumped straight to the map of Redland City local government area, to give you an idea of the snapshot, we're currently looking at 162,000 people. That's our estimated resident population this year. And in 10 years' time, it'll be 180,000 people. So Redland City more or less grows by 20,000 people every decade, what I would call slow but steady growth. In 2016, some of probably our key standouts would be we surpassed the Australian, Queensland and Greater Brisbane population percentage of persons requiring assistance with core activities. And that's quite linked to our ageing profile. So we're looking at our median age in 2016 for Queensland would have been 37, Australia 38, Redland City 42. So Redland City's already surpassed those areas. and the Southern Moreton Bay Islands would be 59. So really over and above what the norm is there. In this graph on the right-hand side would be the residents aged 65 and over by a suburb as a percent of the population. So why we have quite a focus on our island populations, as you can see clear and above, Coochiemadu Island, North Stradbroke Island, slightly less so, but the Southern Moreton Bay Islands in particular, they surpass the Redland City norm, Greater Brisbane, Southeast Queensland, Queensland itself, and Australia. So really, that's some of the emerging issues we have in our area, and I'm hoping that this data can more accurately identify those changing needs over time, because it'll be a bit of an accelerated rate of aging on the islands and in our local government area, and any social data that can help assist to support those communities is fantastic. So that's it. Thank you very much, and I'll hand you back to Georgie.
James, it's actually me, Anne, that you're handing back to. Thanks for a great presentation. Fantastic array of data and great development being led by you there. I've got a number of questions that have come off the chat pane directly. So I'll just remind people that are participating in today to pop your questions now into the chat pane. It'll be your first and only opportunity to have these questions answered. I've got a range of questions that I've received directly, James. One is from Mal, who Mal's from Mica Services, and she does a great job supporting forgotten Australians, those estimated 500,000 Australians who as children were in institutional care due to the social and welfare policies of the 50s, 60s, 70s, 80s, and some would contend into the 90s. Mel's been working on the very island communities that you just identified, and she's actually discovered that a lot of the clients that she supports are actually located on those island communities, and she's been bringing those forgotten Australians together on a regular basis. Mel is interested about how your data system might be utilised for that group. But she questions that forgotten Australians have since the Senate inquiry in 2004, been lobbying for an inclusion question in the census. And they haven't been successful in the next census, but hope to be in the census following that. So I think that's about, 2026, maybe somewhere along that time frame. But she's identified quite a few forgotten Australians, and there's quite a level of research around the social health disadvantage that group is experiencing, and both that they're aging and perhaps for many of them aging prematurely because of the neglect that they had as children. She's really keen to see how we might talk about drilling down on some of the issues for these individuals who are living in the Redlands and trying to live well in the Redlands. Over to you, James.
Thanks, Sam. Mel, that's an excellent question and a really great observation. One of the things I probably should have been more specific with is Council has full access to the back end of that data program, and we can draw in anything that the community is observing, either anecdotally or data. So we're not really reliant so much or totally reliant so much on those formal information sources like census data. So if you're collecting anything that we could visualize and overlay with any other information, it's really, really useful to us. So I would say I'd be happy to work with you to see what information we can draw in and how we can support you to do that as well. One of the analogies that we hear a lot with data is that it's a bit like a lake or twine that's not connected to anything else, but through these systems where you can collaboratively share and then entwine with other things, and you can actually start to knit some of that data together. So there's no reason why we can't start to do some of that work now that we've polished off some of the earlier services. And I'd be really interested to start to visualize some of that information. So I'd be happy to share my information with you. Yeah, that'd be great.
Thanks, James. Another question from Jenny. If we had a service that isn't on the dashboard, how do we add it? What's the process?
So I can do that for you, Jenny. As I said, we've got full access to the back end of that dashboard. It's more or less dropping a geolocational pin on the back end software and publishing that information. And while we do that, we also want to collect some information about what services are being provided, what your capacity is, if you're happy to share that information. And if you're not, we can secure that in a private way so you can see it through a login through your own network. So yeah, we've got full access to control that in the future. What you've seen in the data project that I just shared is really sort of phase one, our first initial collection of information during COVID, based on needs analysis. And we're keen to enhance that up. So if you're not already connected to a network, please let me know. And if you'd like to share some information on your service, I can plug you directly into the dashboard.
Thanks, James. I've got a question here from Nick. How can this data be used during times of emergency?
Really good question. So I'll give you a perfect example of that. So the Southern Moreton Bay Islands, for example, that you saw when we had COVID-19, we had lockdowns for some of those areas, giving, I want to say, the age profile and the immunosusceptibility of certain people in relation to the virus. And that was similar for North Stradbroke Islands. And everyone was hunting around for data to say, how many people do we have that are over this age? How many have needs with core assistance, who is self-isolating, that sort of information. And if they are self-isolating, how do they get food? So one of the aspects of the social data was we saw skyrocketing searches for food, because if you're not aware, the only way in and out of the Southern Moreton Bay Islands is on barge and boat. And they got their food shipped over to them. And because people were going crazy in relation to, I need toilet paper, I need 40 cartons of milk, those food spaces on some of those ferries booked up very quickly. So you had vulnerable people who couldn't access food. So that's so great that we were able to say, well, these are our emergency food providers. This is the capacity that they have. This is where they can service. And these are the connection points of who they should be providing to. So that's a really great connection. And more deeply, you are able, again, not to just see a whole conglomerate or collection of islands, but what's happening individually on those specific spaces so that we can respond to those. And so that's only one aspect of what's occurred so far. Another example would be if you're talking about releases of government funding, you know exactly which local services are responding to certain needs, who's eligible for funding, and even with council zone funding programs, how we can exactly, I guess, path that into the right areas or do targeted allocation of certain things that we know or can validate our social need issues. So there's a number of different applications. And once again, my bias is that as I'm a social planner, I will only look at it from that lens. But any other planner or any other professional could come and say, I can draw parallels between some of those demographic indicators and social needs, and this is how it can enhance what I do. So there's so many different applications, and I'm sure we'll discover a great more through time. But the key to all of that, as I said earlier, is just having collaborative current data on social needs. So I hope that answers your question.
Thanks, James. One question here from a rural and remote provider who's joining us today, Matt. He's very interested in what you're doing here in the Redlands and how it might be utilised in other regions throughout the country. Do you have any views on how this could be used in other regions?
So I'm interested in where Matt is from for a start, but social planning itself is quite a niche aspect of planning as a profession. And we're still sort of evolving the space on how we can measure needs. So I would say this in itself, Matt, is a bit of a pilot project. It may well be one of the first in Queensland, if not Australia, on how we're accurately measuring community needs, adapting and being dynamic information in collaborative working space. So I would say this has got a fantastic application for the social planning profession, for local governments in particular, given how close they are with communities, for individual services, and really in the realm of supporting community needs. And I'd like to showcase a little bit more through those social planning networks in terms of its potential. And also on that front, we've only done a targeted project with the help of the Regional Innovation Data Lab, but that's such a data-rich environment that whatever inquiry you are making is what you're sort of getting out from it. And the Innovation Data Lab were quite explicit in saying that from the front. It depends on the nature of the inquiry that you're making. So there's so much potential based on the question that you're asking, what information is available to you. And I mean, there's so many organizations that carry this data now. It's just the effort on trying to make it collaborative and trying to knit up a bit of a picture collectively. And I think that's the key to it. So we've had some great success with it, but it just starts with some of those conversations that you want to have with the people that you connect to, where there's a willingness to share that sort of information, because it's got a whole host of benefits across the spectrum. But if you want any more information, I'm happy to share my details.
Thanks, James. And one final question. We've got a number of people on the line today and who've expressed interest in this webinar from local aged care providers within the Redlands. But looking at the aged care sector and the community care sector during this period of post-Royal Commission, in a period of immense reform by governments of the sector, there's a number of new data sources that are being required from providers, least of all those related to quality of service delivery in terms of providing some information data around quality indicators and soon to be introduced serious incident reporting and a star rating for residential care facilities. There's been a number of people who couldn't make today's session who wanted to ask the question about perhaps using this data as a real source of looking at some of those national reform agendas and really looking at drilling down on the quality of service provision in the area for that, as you identified, highly ageing populations that are both in the island communities and the mainland. James, are you, your comments on whether you are willing to work further on those sorts of agendas?
Yeah, absolutely. And so I'm happy to share out the dashboard, and you can see in the top left where I can overlay certain networks. We've already got an aged providers network there. So I guess you've got the base layers of information already and available if people want to start feeding into that and even extracting out information that may assist them in the future. But as I said, we did a targeted approach early on, and my goal in the future is to start expanding this out. I'd like to have the whole service cohort supporting Redlands community done over the next 5 years. We're about to head into a census year. We've got 2 large information sources being released this year. One's for early childhood. One is on the volume of community searches being done. And we've also got one on updated population projections. And that'll be assisting local governments do planning in the future. So as I said, we've got the base information there, and definitely let's have a chat and let's see what we can do on that front.
Terrific. Thank you, James. Look, that's all we've got time for questions today. I really like to, on behalf of everyone who's joined us today, James, thank you for sharing your expertise and sharing that great development. We hope that many other collaborations will occur as a result of this webinar, and I know I've been contacted by several people already regarding that. So what's coming up next for us in the collaborative? We just wanted to flag, wearing our International Standards Organisation's hats, that we're actually going to be hosting a global perspectives forum for ageing societies on the 15th of July. This session is going to bring about together recognised world leaders in research, service delivery and support of older people around the globe. including some speakers from the United Nations and from the World Health Organization, a leading researcher from Japan, and several other presenters who have been involved along with ourselves in the development of ISO TC 314 Aging Society standards. Some of you may have attended previous forums where we've discussed that standard development. We've been involved in the standards development around ageing workforces, dementia inclusive communities, and carer inclusive organisations. But we're very proud to have been selected to be one of the showcase projects for an upcoming standard development around multi-generational communities, and that's certainly where our heart and passion is, of communities that engage all groups and don't isolate or marginalise any groups. So that's an important standard development which will be occurring over the next couple of years. For more information about this forum, it's a free forum. You'll note the time is 8 p.m. to 10:30 p.m. Queensland Australian time, and that really is to ensure that all countries can participate. Encourage you to register for that, and more information on that will be available from our site at www.satcommunity.com.au. We will be posting today's webinar and the Smart Assistive Technology Collaborative. So again, as I reminded you earlier, if you haven't already registered, go online and register. You'll also gain access to our resources and find more about the events that are occurring both in our local, national and international areas. We've got a number of exciting projects that we're to publish shortly on the site, so encourage you to join. And the details are again on the site now. Once again, I'd like to thank the members of the collaborative research team, and particularly Georgia Gould, who's organised today's webinar. And again, I'd like to specifically thank our expert advisor on today's webinar, James O'Reilly from Redland City Council. Thanks, James, again for your presentation, and thank you everyone for attending today's session.